So this will be the specific capsular work for the low back or the lumbar spine. Remember, we did our global motion before standing up. This is going to be a seated position because we want the pelvis locked down and as little motion from everywhere else as possible. This time we're going to take our thumb with your hand kind of in this L shape. You can find the lumbar spine by simply putting your hand on your hip and letting your thumb come across. Remember, our point and purpose is not to dig into the tissues or to push very hard. It's simply a marker for your brain to help focus on the area that we're pushing. Now, as you touch here, if you squeeze just a little bit and it's a hard, bony feel, you're no longer in the lumbar spine. You might be on your hip, you might be in your sacrum. So come up just a little bit and look for something a little softer, okay? That's going to put you into the lumbar spine where we want this motion to happen. Now from here, here's our goal. We want those joints to pull apart. So again, we're going to work in that flexion extension and just a small amount of rotation. But notice how little motion actually comes from the rest of my body. We want to keep it all in that low back. So imagine that it's just compressing and bowing towards the back side. So I've identified my area, and I'm going to squeeze myself forward into flexion and a small amount of rotation. Okay, another angle here just so you can see me from the side. I squeeze into flexion. Notice it's my low back moving. I'm not hunching over through my shoulders and through my chest. I'm right here in the lumbar spine, squeezing, and just a small bit of rotation away from the hand that I'm using. So if I'm using my right hand in this case, as I squeeze forward, I'm going to turn towards my left knee. Okay? One more time without my hand there so you can see what my spine is doing. Again, this is just for demonstration purposes. Do not perform it this way. So I'm bowing in the low back, and I'm turning towards the opposite side. Remember, these are to be done in volume, as many throughout the day as possible, keeping the motion focused in that specific segment. Remember, we're going to work up into the upper lumbar spine, and we're also going to do the other side.